Hi, my name's Morgan. The movement that I was given is hip flexion, so I'm just gonna get started. Hi Mom, my name's Morgan. I'll be your therapist today. I'm just gonna be testing how well you can flex your hip and lift your leg and see how strong your muscles are, okay? Okay, so first I'm gonna have you lay all the way back and put your head on the pillow. Now normally my patient here would be on a proper testing mat, and when I test her manual muscle test, her legs would be off the floor, but given the circumstances, we're just gonna pretend. So I'm gonna be testing her right lower extremity in hip flexion. So, Mom, this is the movement that I want you to do, okay? You can bend your knee a little.
Okay.
Can you show me? Good job.
Thank you.
Maybe put the video over here so you can see this angle. Okay, so when I'm testing her range of motion, I'm going to palpate for the greater trochanter of the femur on the lateral aspect of her lower extremity. The stable arm is going to be parallel with the mid-axillary line of her trunk on the lateral aspect, and the movable arm is going to stay parallel with the lateral aspect of her femur. Okay, Mom, do you remember the movement that we just did? All right, go ahead and do that for me.
Go up as high as I can.
Yep, as far as you can go. Okay, she has 0 to 105 degrees, and normal range of motion is 0 to 130 for hip flexion. So now we'll just move right into the manual muscle test. If you wouldn't mind sitting up.
Sure.
So, like I said before, normally her feet would be dangling off the test mat, but we'll just pretend for this, if you wouldn't mind moving your hands out of the way. So I'm going to stabilize at the contralateral pelvis, more specifically the iliac crest, and I'm going to really watch her pelvis and her lumbar region for compensatory movements. So I'm going to stabilize here, and I'm going to apply resistance at her distal femur, proximal to the knee. So Mom, this is the movement that I want you to do.
Okay.
Can you show me it? Good job. Okay, so now I'm gonna go ahead and have you meet my hand halfway, and on the count of 3, I'm gonna apply resistance and don't let my hand move, okay?
Okay.
1, 2, 3. Hold, hold, hold. Good job. So now she was able to hold resistance, but let's say that she wasn't able to. I would put her in the gravity minimized position. So I'm gonna have you go ahead and lay on your side and face this way. So just pretend I'm standing up, because this wouldn't be proper body mechanics. But I'm gonna go ahead and be behind her so I can support her in the sideline position. I'll have her on her non-testing side. Since we're testing the right extremity, I'll have her bend her lower leg and support her testing extremity through hip flexion. So, and I'm gonna go ahead and stabilize at the pelvis as well. So I'll help her move through the movement. That's the movement that you're gonna do. Can you go ahead and do it for me?
Sure.
Good job. So now through hip flexion, my patient is using the muscles, the rectus femoris, the sartorius, and the iliopsoas. And the nerve that she is, that's innervating those muscles is the femoral nerve. Let me just make sure I didn't miss anything. Okay, I think, Dad, stop. I think that's it. Thank you for coming to my therapy office. You can stop it. Dad, stop.
I could.